Welcome to the conference session titled Supportive Care for Patients. Thank you for joining us today. My name is Nikki Ashadu. I'm the Program Content Manager here at AAMDSIF. As we get started, AAMDSIF would like to recognize the generosity of our corporate sponsors, Diamond Level sponsors Alexion and Novartis, Gold Level sponsors Apellis and Genentech, and the generous support of patients, families, and caregivers for supporting our conference today. Immediately following the presentation, there will be a question and answer session. When asking questions, please wait for the microphone so everyone can hear the question you are asking. Please do not share private health information in your question. Our speaker cannot answer any specific questions related to your healthcare. Today's specialist is Erin Kopp. Erin has been practicing as a nurse practitioner for over 15 years. She has been at the City of Hope for the last 10 years. She's currently serving as the Director of Advanced Practice. She has been in nursing for over 25 years, and she has a passion for inspiring resilience and strength in patients and families she serves. So please welcome Erin.
Thank you. Thank you for the introduction. It's a unique opportunity, I think, to talk about this topic. You know, we say that things happen for a reason. And while I am a nurse practitioner, I do work at City of Hope. And so I work within this realm and have been on the provider side with patients. This last year, I've actually been on the friend and caregiver side for somebody who went through actually aplastic anemia, PNH, and now MDS, getting ready for bone marrow transplant. So it was such a unique experience because coming up here and sharing with you, well, this is what you can do. And I know you've gotten a lot of scientific information so far in this conference, but this was an opportunity to really talk about what it is to be a patient or somebody who loves somebody who's going through one of these issues and how to really make a difference. So the key thing is really support, and support from others, but also from yourself is the key to success. So when you talk about a diagnosis happens to you, right? You're walking around, you're given this diagnosis, medications are recommended to you, treatment is outlined for you, and then what do you do to navigate? There's a lot of things that are out of the control of the individual. And so the question is, well, what am I supposed to do with all of this? If you're on my side and I say, well, I want you to take these medications, this is the best treatment that we can recommend, this is what it's going to be like, that's one thing. But when you walk out of our office, then what do? So you're experiencing the diseases, the treatments, and the life changes. And one thing that was really critical that I found both through this actual group, but also watching my friend and engaging with my friend, is that finding ways to manage through these hardships, and they does empower you and your team. And I can't stress this enough. Supportive care or any of the care can't happen without the individuals who are engaging in it, right? We can have a conversation. I can tell you this is the best choice, but if it doesn't resonate with you, if you don't have the resources to do it, it doesn't matter. And it also often feels like, and this is what was expressed to me over and over and over again by my friend, who's actually a very well-educated in healthcare, saying, you know, I feel like I don't get to make any choices. People are just throwing this on me. And the times that she expressed feeling helpless or hopeless often had to do with that. So I want to talk a little bit about taking back control, that choices really do abound, and every choice offers you some of that control back. I mentioned that I like to talk about resilience. Actually, my doctoral program was focused on resilience in a different space, but it really is the same thing. When you face issues that you think you can't, every single time you make a choice and you're able to succeed, it gives you that hope that you can do it again and again and again. And the illnesses that we're talking about today really have a chronicity component to it. So you get lots of choices if we switch the paradigm a little bit and understand that we're going to recommend treatment, but if you engage and ask us questions about the treatment, about the how and the why, you're adults. Adult learners don't just accept things, right? You wouldn't go and order some food at a restaurant and they just tell you what you're going to have and not why, and not listen to what you had to say. You wouldn't accept something that simple. So why would you accept something so important without really engaging and knowing what's going on. With the side effects, engage to understand what to expect and what choices there are to manage. You're telling me all this stuff. You mean I just have to sit here and just go through it? Well, some of it, but some of it can be mitigated. Some of it can be helped out, but it has to fit in your lifestyle. I'll tell you, I don't run unless there's a bear chasing after me, and that bear better carry a knife. That's the only time that I'm running. So if somebody told me, oh, exercise is the way to control what's going on, you need to run a mile every day, it's never going to happen. So you being a part of asking the questions and understanding, and then communicate changes to partner with us. That is the biggest thing. Maybe the chemotherapy, maybe the treatment regimen, there's not a lot of choices, but if you partner with us and share what you're experiencing, we can be so much more proactive and help prevent some of the side effects that we're going to talk about. And resources, everyone loves Dr. Google, but Dr. Google doesn't have a degree. Okay. So when you go online and you're looking for resources, please try to sift them out, bring them to us, ask other people, and find reputable sources of information like what you're doing today. When I went out looking for resources, I looked here. Right? I knew what I had experienced. I know the professional resources. I knew what I had seen with my friend, but I'll tell you, this was the best choice for me. So a lot of what I'm talking about today is a little bit of an adaptation of what you can find in depth if you go on the website for patient resources for this organization. But you got the diagnosis, you understand that things are going to happen. The next thing is really understanding and then planning. Planning and committing. It's a big endeavor. You wouldn't go on a trip without planning somewhat. So it's asking those questions and then say, okay, there's 3 major areas this is going to affect me. Let's start with my body. Simplest one. I can see it. I can see lab values. All right, my hemoglobin is 6.2. I can look at that. But some examples are fatigue, right? And we'll talk about how prevalent that is. You already know. If you're sitting here, you have an idea, right, about fatigue. Physical activity. Is it important? How do I manage it? Where does it fit in? And what symptoms? But when we're talking about the mind, the emotions, worry, shock, anxiety, depression, all of these things are very common, not usually well accepted by caregivers and family members. And why? When I was sitting there on the other side and I was listening to the physicians talking to my friend, I wanted her to feel like she could be strong. I wanted her to feel like we were going to do this together. But in reality, when you're feeling anxious or worried about something, how much does it help to have somebody say, we're going to do it. It's going to be okay. Sometimes, right? Sometimes you need that arm to pick you up. And sometimes it feels like you're being invalidated. Like, wait a minute here. You walk around and you're tired when you haven't gotten an hour of sleep that you wanted, that extra hour. I'm walking around here and I have no blood cells. I don't have hemoglobin. I don't have platelets. I don't have white blood cells. And you're telling me not to worry. So really understanding and appreciating both as the patient or as the family and the caregiver, how important it is to be able to acknowledge. And then within the spirit, faith means something unique to everybody. Hope means something unique to everybody. I work in a place that hope is part of our name. I remind myself of that every time I walk in the door. I am supposed to be, as the provider, a beacon of hope for the individuals that I work with. But addressing when that hope and that faith is compromised is something to remember and to focus on. So some advice from the experts, as I mentioned, this resource website, is find the problem, but then really choosing to acknowledge the issue. My friend chose to ignore the issue as often as possible. Very professional, very busy, had gone through another major health issue in her life, and acknowledging what was happening to her meant failure. Because in her first major health issue, she didn't. She just went. She would go and have treatment and go right to work. She would continue to go out with her friends. She would show up every day and vomit in the bathroom and felt like nobody knew. And that to her was success. So the concept of acknowledging what was actually happening was not something she was willing to do. But her first event was like a circumscribed, okay, you have these 6 months, you're going to feel bad, but you're going to come out on the other side and you're going to be great. That's not necessarily what happens, right? We just heard from Ruth that she had a diagnosis, went through ATG, and then was told it could be another 6 months or so before your counts get back to normal. But really, she had no idea when it would occur. There wasn't a start and a finish. And that didn't sit well with my friend, and it doesn't sit well with most people. You get really tired of being tired. So acknowledging the problem is the first step. And then making lots of plans, because none of the plans you make are going to pan out the way you expect them to. They might, but when you plan, what I mean is don't plan every unique detail. We're going to talk about some strategies to use, but planning, like if I know I want to go somewhere a week from now, and I know when my treatments are, and I make it clear to my provider, this is what's important to me for my quality of life. I must go to this wedding. I must graduate from this program. Then we can work with you to create plans and help you kind of find plan B, C, D, whatever it takes to get there. Connecting with others to hold you up when you are sure you will fall. There are many times where you are supposed to feel exhausted, emotionally, mentally, physically. And we need those individuals who, for whatever reason, are always stalwart and there and ready to pick you up. That is part of the plan. Because supportive management is not just about, well, this is what you can do for nausea. It is really about being available and ready to understand and accept whatever treatments we have to do. And every time again, know that when you fall and you pick yourself up, then it proves to you and to others that you can do that over and over. So starting with that emotional facet of life, first thing is sit with the emotions. We don't expect you, when you come in to talk to us about therapy, to sit there and smile and always be strong. If you need to cry, if you want to smile, if you want to laugh, all of that is appropriate. It's just acknowledging what's going on and making the conscious choice to move ahead to whatever's next, choosing to enjoy life where it is in those moments. But a lot of that has to do with being able to choose to ask for help. I personally am not good at that. I personally feel like if I just go through things, I've gone through a lot, so I'm super strong and I'm just going to do it on my own. But what happens is, for those of you who are caregivers, friends, families, loved ones, it feels very difficult, right? Because all I wanted to do for my friend was hug her and hold her and protect her and be there and make sure that she was okay. But I can remember a very distinct time. Her hemoglobin was very low. She had walked to where I was and she was having chills and she just felt like she was going to crawl out of her skin. And I just went over to touch her back and it was, don't touch me. Not because she didn't want somebody, because really inside, she told me later, she would love for somebody to be able to just hold her, but she wasn't able to ask for help. She had made a choice, right, to do something independently and went like this, but she wanted this too. So those are conflicting emotions that many of us haven't felt. And if we have, many of the people we interact with haven't felt, and it's very difficult to explain. So it's working through ways. It's also having like keywords. If you're really not feeling well enough to do something, maybe you don't want to explain every time. I don't want to go because I feel nauseated. I've told you this 12 times. It makes me feel bad every time I have to say it. Could there just be a code word instead? Or just, we're going to do this tomorrow, right? And leaving it there. So it's acknowledging the emotions and tying in that plan and being able to communicate that when you feel well. Now, this exercise part, and I said, you must be kidding, because realistically, I watched her really have to struggle to get out of a chair. And the concept of exercising, it is really actually recommended, right? But how do you walk when you can barely sit? Well, if you think you have to walk 30 to 60 minutes a day in a row, there are many days that's not going to happen, right? However, losing muscle mass and becoming deconditioned before or during treatment can actually make rehabilitation from that much harder. So some of the examples or some of the recommendations, even walking for 5 minutes. But we're going to talk about how you conserve your energy so you're able to do that next. But keep that in mind. And stretching is exercise too. There's actually a lot of evidence that stretching, especially if you're over 40, like I am, has a lot to do with your physical health. So sitting and stretching those muscles out, even when you're contracting different muscles, contributes to being healthy. Don't be a hero, though. The other thing that I watched, like I said, walking a half of a mile when your hemoglobin is 7.2, probably not the best idea, right? Going to play, I like to play pickleball. Playing pickleball when you have a platelet count of 30,000, not a good idea. To show yourself, and I watched this happen, right? I'm going to show you, body, you're showing yourself that I can do this. I'm going to prove that I can still do this to myself. It's not about anybody else. It was about to herself. But understanding all of your exercise and everything we do has to be within parameters and safety for whatever medications you're on or for what your disease itself is. So I mentioned fatigue, right? Tired is not fatigue. The only way that I can describe fatigue to individuals is if you have had a very severe flu and you feel like there is a truck and on top of the truck are like a ton of elephants and they are all sitting on your body. That would be the best way to describe fatigue. It is when you feel like you can literally not get your arm up and that everything you need to do takes more energy than you have. But 90% of individuals who deal with aplastic anemia or PNH or MDH have excessive fatigue. So what do people tell you? You need to sleep more. Oh, please don't get up. You need more naps. No, that is not accurate. You can nap, absolutely, but that will not solve the problem. And that's what others want to do for you, right? I want to solve the problem for you. You're just sad. Well, maybe I am, but that is not the reason for the fatigue. And if you try to cheer me up and we go and talk, it will help certain things, but not necessarily this. One person will tell you, stop doing things. Sit there. You're like, the Fabergé eggs that are so fragile. That's what you start to feel like everyone's looking at you. And I can't tell you how many times she used the term that people wanted to bubble wrap her. And man, she was right. Right? If you could just walk around in bubble wrap, that would be perfect for everyone else. But then other people will tell you, well, you have to do more. You're just fatigued because you're sitting around a lot and you're deconditioned. Let's go. So proactive conservation is a term I want to share with you. And if you haven't thought about it, is something that I remember learning 25 years ago when I started in nursing. And it's the concept that you decide what's important for you. And it could be just as simple as what's important this next hour. I really want to get up and shower. Okay, I'm tired though. So I'm not going to do the 5 other things I'd like to get done today before I shower. So I'm going to conserve my energy with the intention of doing the things that are important. And then I will have a list of things that I can do later and spread them out throughout the day. When we have you in the hospital, if you are, and you have a really astute nurse and medical team, they will be doing that whether you realize it or not. All right. Keeping an energy diary is helpful because it will help you find patterns. So if you're taking certain medications and you haven't figured out that that's the contributor to the fatigue, or when your counts reach a certain level, and not just hemoglobin, because people who have low white blood count or low platelets can also have fatigue. So being able to keep that energy diary, it's like, oh, whenever my platelets drop below 20,000, I'm walking around, my heart's beating out of my chest. I didn't realize it was contributing. And this is my favorite, and I think I just use this in life, is having an exit plan. If you don't want to explain to yourself or your family members, it's even more difficult when you're in a social situation, right? I have a patient that I work with for a very long time, and church is very important to her. And therefore, it should be. But she gets very tired. and she has certain symptoms that she doesn't want to have to explain. So before she goes to church, she and her husband have a plan of what they're going to say when they get there. So they have an exit plan already. We love being here. We may have to go in about 20 minutes because we have X. Right? Then you already set it up. You can stay longer than 20 minutes, but you already have an exit plan. And you don't have to explain it to anybody. Okay. So blood needs friends too. You're all here. I'm talking about how you need friends, but we can't forget that when we're talking about bone marrow and we're talking about hematopoiesis or the production of any blood cells have certain components that they need. So while it won't cure what you have, it is important to remember nutrition is a key factor in how good you will feel. Red blood cells need certain components. You need iron to be able to build them, right? We have found that vitamin D is a critical component when it comes to the immune system. So building blocks for production of these cells should be a part of your diet. If you're not getting that information, I'll tell you, if I'm your nurse practitioner and you're coming in to talk to me for the 20 minutes that we have allotted, chances are you're asking me about your medications, what's next, and how you feel. Maybe not nutrition. So that's why it's critical to find those resources, either online, through a dietitian, ask for a referral. What specific vitamins and minerals? Because a lot of people have come to me. Do you remember it was very popular to get high dose vitamin C? If you didn't hear it, many people were getting IV, high doses vitamin C, without realizing that it can cause you to bleed. So I have individuals, now if you're just taking vitamin C at home, chances are you just pee it out, all right? Your body keeps what it needs and then it gets rid of it. But I actually had individuals who were on treatment who got high dose vitamin C, not realizing, and then had bleeding issues. So it's vitamins and minerals that fit in with what your treatment plan is. Protein is key. Protein is a builder of many of the things that we need in our bodies, including our blood cells. Some recommendations include limiting refined foods, processed foods. That does not mean eliminate the things you love. And I really want to stress that. It's about moderation. Sometimes I've had patients come in and say, I can't eat anything because we're going to talk about no appetite. And I will be the first one to say, if ice cream is on your list and that's it, now is not the time to worry about it. Haagen-Dazs can be your best friend, okay? Because you're going to get past that. Neutropenia precautions, if your white blood cells are low enough, it really is important to remember you're at high risk for infection. No joke, you guys. I went to the salad bar with my friend more than once, and this individual had almost no white count. And she knows for many years that the salad bar is not where you're supposed to be when your white blood cells are low, simply because foodborne bacteria are a risk. And I had to stop her mid-tong, right? I wanted to see if she would remember, because it's hard. If you love sushi, if you like eating raw foods, it can be a difficult choice to make. But please always check in with your providers so we can give you those specific precautions. I know Dr. Nakamura, who's talking about transplant, is talking about that as well. Intimacy. One thing that we'll rarely talk about when you go to the doctor is sexual intimacy. And I think that's because many people are very uncomfortable with the topic. I think in this discussion, I want to touch on a couple of things, including that is emotional closeness. I shared with you that even with just my friend, who's a very good friend, that it became difficult to know how to be close. It became difficult to know how to talk. It became difficult to work without worrying, oh my gosh, am I going to offend her by asking her how she feels or telling her, oh, you look tired today, or suggesting that she go home instead of being in a room with 100 people with no mask on. That put a wedge in our relationship. But I also know that this individual and everyone I've worked with has a craving for emotional support. So finding the balance between what you're feeling and having people who really understand. The start comes with having a discussion when you feel well enough. Just like I said, conserve your energy for when you want to do physical things. When you feel good enough, Create that space and that safe time for the people who are most important to you to really be able to discuss the safe space of where you can maintain that emotional closeness. That leads into balancing health and relationship demands and needs. Sexual intimacy is one thing. Again, when we're talking about if your white blood cell count is very low, you're at risk of infections of all types. If you have a platelet count of 5,000, physical contact, even in and of itself, can be a challenge because there's a risk. So it is being able, going back to empowering and asking questions, is to ask questions about what is safe, what will work, and it's our job to give you the answers. This hug me, don't touch me is what I was sharing. It's that dichotomy of I want to be held, but that may not mean physical, right? So if you're the friend, loved one, caregiver, it may be your job to ask and say, I want to be here for you, but I want to know what feels okay for you. Without somebody having to come and tell you, opening the door to that communication gives the individual a safe space to answer. And sometimes, and this is one of the biggest things, is that you're too afraid to be close. If you are facing your own fears about mortality, your own fears about what's happening next, it is very difficult sometimes to pull on the people that you love the most. I know that I personally caused a rift between my husband and I. I had an experience, this was with asthma, but I ended up in the emergency room and they were going to potentially put me on a ventilator. And I told them not to call my husband. And the reason for that was that I was so overwhelmed and I couldn't deal with the emotion of watching him see me and his fear and his concern and his, because all I could do was stand in this space to face what was going on with me. And that may sound selfish, but it was protective. And realistically, I wanted to protect him as well. Yeah. Oh, is there a microphone? I'm sorry. I know. Sorry.
Thank you. I want to take this a little bit further than just intimacy.
Yes.
Sexuality.
Yes.
In reference to, I'm a single person. And ever since I've been diagnosed with my disease, I'm very afraid to be sexually intimate with a man because I'm afraid I might catch, I'm older too. And some of my friends have been around the block. So on. I was married and, I was intimate with several men over the years. But what would you suggest to single patients that miss that intimacy instead of just not dealing with it? What would you recommend?
So it's funny that you bring this up because in talking about things, if you're in a committed relationship and you believe it's monogamous, then that's the safest choice you think that you can make, right? In that relationship. And oftentimes conversations are not had even in that relationship. The fear is real. So if you choose to have sexual contact of kind of any kind with an individual, it has to be with somebody that you're comfortable enough to ask and kind of insist on having any kind of testing that you can test for. I would also say that speak to us because there are certain times where it's not safe to have specific sexual encounters based on what your counts are. I mentioned platelets, right? If your platelets are 15,000, not the best time. But it really is when you're stable with your counts, it's having that conversation with yourself was what are you okay with in terms of emotional intimacy that should then open that conversation to sexual intimacy. So I know there's not a straight answer to that, but it's really about to protect yourself. It doesn't mean you have to be in isolation. It does mean you have to set some expectations and parameters for any individual you're going to engage with. And one of those things has to be if I am not comfortable enough with you to tell you about my disorder, my disease, and what my specific requirements are, is this the right person to be with? Because you are putting yourself at risk. All right. So dealing with the hard stuff, we talked a lot about some of the psychological support, the emotional support, but there are some physical things that can and will happen or have happened to you that nobody's even heard of, right? I know we talked about aplastic anemia. Ruth discussed that she had ATG. There is a risk for serum sickness. Hearing the term serum sickness is one thing, watching it and experiencing it is a completely different animal. Again, I use the term flu. I think we overuse the term flu like it's not bad. If you have had the flu, it is bad, right? Chilling that where you can't stop shaking, having headaches where you can't think, you can't lie down because the headaches are so bad. Blood pressure going all over the place, itchy throat, some difficulty breathing. All of these symptoms can happen with serum sickness, and they can happen secondary to being discharged from the hospital. And so again, witnessed this. And one thing that was hard is when you are sick, you don't want to be sicker. And one of the biggest hurdles that I have to watch and work with my patients is really understanding to prevent something as severe as serum sickness, or to allow us to treat you early so we don't run into the worst problems. We need for you to let us know early. There are medications, right, for all of these things. Pain, bleeding, gum issues. I mean, no one's even heard of that your gums are going to get swollen and that, they're touching the side of your cheek and then they're bleeding when you touch them, not because your platelets are low, because tacrolimus causes what's called gingival hyperplasia. Now, if I told somebody who's never been through that, or my husband who does insurance and has nothing to do with healthcare, he'd look at me like I was speaking a different language, right? Because it's only if you've gone through it. I mentioned blood pressure, swelling, dizziness, not wanting to eat, nausea, constipation, diarrhea. I know that Dr. Zachariah is going to come up and do some more in-depth discussion about some symptoms, but I do want to share with you that we do have tricks up our sleeve, and it's important to share with us. One thing I didn't put up here is severe muscle cramps. I don't know if anyone has experienced those, but something that's very easy to help with that? Magnesium. And we utilize magnesium in other spaces, and it doesn't mean your magnesium has to be low, but a magnesium supplement can be very effective. Neuropathy, like the numbness and tingling in your hands and your feet, can happen, like needles, like pins and needles. Things like vitamin B supplementation are helpful. We also have medications like gabapentin or Cymbalta, and these are just general things, right? Not specific to you. You need to ask us, but these are things that we have in our arsenal to help. So what I want to end with, so that if there are any questions, is really getting through every second. Sometimes the concept of getting through a day is far more overwhelming than you can see. So it really is about, I'm just going to get through this moment and next moment and the next moment, because there really is no one who can understand your journey better than you. So that's why I bring it back to the term empowerment and choosing to show up for yourself and allowing others to show up for you. I recommend this, right? Build a toolbox, fill it with knowledge and courage. Let your provider team, let your friends, family, loved ones help you build the box. Be there for the courage, and then go back to it often. So understand, I'm not going to go once and I'm going to pick the right screwdriver, and it's going to be the right one for everything I go in. Or I need a hammer for everything I go into. It might be different. But power comes from choice, from planning and committing. So that's what I want to leave you with. I highly recommend, if you have not truly delved into the website for this amazing organization, please do. It was so enlightening for me. It was very helpful for me because I wasn't in the provider section, speaking only as a friend and a loved one. So helpful for me to try to understand and be able to at least be open and hear what my friend needed. So again, any questions or comments that anyone has? Okay. Thank you all for your time.
Thank you, Dr. Erin, for sharing your time and expertise with us.